I've never seen this before, but I'm taking Oliver to like the non-urgent care doctor because look at his ear. Just popped up today. His arm on the same side as this. It almost looks like some kind of infection. So we're gonna go see what the doctor says, and I'll keep everyone.
That honey crusted rash on the ear, then suddenly on the arm, that's giving superficial skin infection going on a tour. And the likely culprit is impetigo. Hey, I'm Dr. Mona here, pediatrician mom, and someone who's here to make sense of all things child health, development, and parenting so you can be a more confident parent. If that's your vibe, hit follow if you're not already. Impetigo is a superficial bacterial infection, meaning on the surface of the skin, usually caused by bacteria, staph, or strep. These bacteria live on our skin all the time in healthy amounts, just minding their own business. But give them an opening like a mosquito bite and scratching, eczema flare, or too much irritation, and they can throw a full-blown skin party. Kids can have it in one area, they scratch it, and then they touch other parts of the ear. Maybe there was an open cut there, and it spreads the infection. The classic look, that honey-colored crust near the mouth, nose, or ears, that's non-bullous impetigo, the most common kind. But sometimes, like in that video on the arm, we see bullous impetigo, which forms blisters that can ooze or drain. And here's how it can look on melanated or darker skin. Notice the honey-crusted lesion. Hello, impetigo. Bullous lesions might look like clear or yellow fluid-filled bubbles on darker skin tones, not always that textbook pink. The treatment, if there's small spots, we go with topical antibiotics like mupirocin and keeping the area covered if possible with a Band-Aid. But if it's spreading fast or involving multiple areas, well, likely we'll need to give an oral antibiotic on top of the topical antibiotic to get ahead of it. How can we prevent this? Wash hands a lot. Keep their nails cut short to reduce scratching and introducing bacteria that way. No sharing towels, loveys, or pillows until it's cleared. Moisturize eczema-prone skin to keep that barrier strong and bacteria-resistant, and use anti-itch remedies for bug bites. Call your clinician if you notice these spots or there's fever or rapid spreading. So yes, that crusty rash, it's impetigo. It's not about being dirty, it's about opportunity. Even normal skin bacteria can go rogue when they find an entry point. That's why kids with eczema, bug bites, or scraped knees are prime targets. And when it spreads, that's called auto-inoculation. They touch, they scratch, they smear it like it's an art project to other parts of their body, and suddenly it's showing up everywhere. That's why we act fast, because while impetigo itself is treatable, we don't want to risk it turning into deeper infections like cellulitis, or in very rare cases causing kidney inflammation. So yes, this is one of those moments where you're gonna say, I'm so glad Dr. Mona told me about this, and I'm glad I called my pediatrician.